Hello friends, welcome to Dr.Bone YouTube channel. Today we have come up with a new topic, that is, can we get an MRI done with an orthopedic implant in our body? This is a regular question which is asked by many patients to any orthopedician. So most of the patients, they would have got any surgery done earlier and they would have lost the data that which implant was used in their surgery. Such conditions, they have a doubt and they come to a doctor and they will keep on asking to us. Let us know about all the contraindications, what are all relative contraindications, and what are all not contraindicated. So first one is, let's go with contraindications. What are all the contraindications to get an MRI done? Contraindications, first one, if we have any cardiac pacemakers, the doctor would have implanted a pacemaker. Then in such scenarios, the patient is advised not to get any MRI done and it is completely contraindicated. And second one, if the patient has any cochlear implant, in such scenario also, the doctors advise not to get any MRI done for that particular patient, and it is also completely contraindicated. And third one, you are not supposed to carry any magnetic devices into the near to the MRI machine, and that is also contraindicated. And fourth one, suppose if a patient had any bullet in his body, and it is not damaging his any visceral organs, in such conditions the doctor would have left that bullet inside the human body. In such conditions also, you can leave that bullet in the body and better not to get any MRI done. And the next condition is, if the patient has any iron foreign body, in such condition also better you can avoid getting any MRI done. And these are all the contraindications to get an MRI done. So whenever you have all these conditions, better to avoid to get an MRI done. Next, let us go to relative contraindications. So first one is claustrophobia. Suppose if a patient has any fear to closed environment or the closed room, then the patient will feel uncomfortable to get an MRI done. So claustrophobia is a relative contraindication to MRI. Now, the next condition is, suppose there is a pregnant lady in the first trimester. In such conditions also, we don't have enough data to say that it is safe for, that is, pregnant female in the first trimester to get an MRI done, because ethical committees, they don't allow us to get these trials done. So we don't have enough data, so we considered that as relative contraindication. Now what are all the conditions we can get an MRI done? So we don't have any contraindications in the following conditions. First one is, if the patient has any orthopedic implant, then it is not contraindicated to get an MRI done. The next condition is, if the patient has some dental filling, or if the patient have any dental implant. In those patients also, we can get an MRI done without any fear. There are patients who have this cholecystectomy clips. In these patients also, we don't have any contraindications. They can also get an MRI done. Other few conditions are intrauterine contraceptive devices. This is made of copper. These patients also can get an MRI done if it is necessary. And the next condition is coronary stents. If the patient have any coronary stents, these patients also can get an MRI done without any fear. And the next condition where we can get an MRI done is the patients who have, or the people who have tattoos on their skin for different colors. To get that different color on the tattoo, they use heavy metals earlier, but nowadays they are not using that heavy metals, so you can happily get an MRI done. But in old days, they used to say that it can generate heat and there can be a fire over their skin. In such conditions, you can ask, or you can get a button where you can stop that MRI done. I hope this should be helpful for everybody, and this is all you should know whenever you are getting an MRI done. Thank you. Thanks for watching.